Imagine waking up every morning feeling completely normal. You go to work, spend time with your family, laugh with your friends, and continue your routine without a second thought. Then one day, after a routine medical checkup, a doctor quietly says, "I'm sorry, but this is cancer." Most people believe cancer always announces itself with unbearable pain or dramatic symptoms. The truth is far more frightening. Many cancers begin silently. They whisper instead of scream. The earliest warning signs are often so small and so common that people blame stress, aging, poor sleep, or a busy lifestyle. By the time stronger symptoms appear, the disease may already have progressed. That is why today's video could genuinely save a life, not by creating fear, but by helping you recognize what your body might be trying to tell you long before it's too late. Before we begin, I want to make one thing absolutely clear. Having one or even several of these symptoms does not automatically mean you have cancer. Many of these signs are caused by much more common and treatable conditions. However, if a symptom is persistent, unusual for you, or continues for several weeks despite treatment or lifestyle changes, it deserves medical attention. Your body communicates through changes, and learning to recognize those changes can make all the difference. Today, we'll discuss 9 early cancer symptoms that millions of people ignore every single day. Some of them may surprise you because they don't seem related to cancer at all. Let's begin with one of the most overlooked warning signs. Symptom number 1. Unexplained weight loss. Most people celebrate losing weight without trying. Friends compliment them. Family members ask for diet secrets. But when weight begins dropping, even though your eating habits and physical activity haven't changed, your body may be trying to signal that something isn't right. Doctors generally become concerned when someone unintentionally loses around 5% or more of their body weight over a period of 6 to 12 months. For example, if a person weighing 180 pounds suddenly loses around 10 pounds without making any effort, it's worth investigating. Cancer cells consume enormous amounts of energy. They can also trigger inflammation and alter the body's metabolism, causing calories to burn faster than normal. Even when a person eats enough food, they may continue losing weight. This symptom is commonly associated with cancers involving the pancreas, stomach, esophagus, lungs, and sometimes blood cancers such as leukemia or lymphoma. However, unexplained weight loss can also occur because of thyroid disease, diabetes, digestive disorders, depression, or chronic infections. That is exactly why it should never be ignored or self-diagnosed. Many people tell themselves, "I'm probably just stressed," or "I've been eating a little less lately." Weeks turn into months, and they delay seeing a doctor because they actually enjoy seeing a smaller number on the scale. Unfortunately, by the time additional symptoms appear, valuable time may already have been lost. If your body is changing without a clear explanation, don't simply celebrate it. Ask why it's happening. Symptom number 2. Constant fatigue that doesn't improve with rest. Everyone feels tired occasionally. Modern life is exhausting. Long work hours, family responsibilities, poor sleep, and emotional stress can leave anyone feeling drained. But cancer-related fatigue is very different. Imagine sleeping for 8 or even 10 hours, taking a weekend off, drinking coffee, exercising, and still feeling completely exhausted. It feels as though every movement requires tremendous effort. Some patients describe it as having their batteries permanently stuck at 10%. Cancer can cause fatigue in several ways. The disease may interfere with normal metabolism, create chronic inflammation, reduce oxygen delivery through anemia, or place enormous demands on the immune system. In some cases, fatigue becomes noticeable months before a cancer diagnosis. This type of fatigue is particularly common in leukemia, colon cancer, stomach cancer, and several other cancers, although it can occur with many different conditions as well. Once again, fatigue alone doesn't mean cancer. Sleep disorders, thyroid problems, depression, Vitamin deficiencies, heart disease, and many other medical conditions can cause similar symptoms. The important question isn't simply whether you're tired, it's whether your fatigue feels unusual for you. Is it getting progressively worse? Does it interfere with daily activities you previously handled easily? Does it continue despite getting adequate rest? These are the situations that deserve a professional medical evaluation, instead of simply assuming you'll feel better next week. Symptom number 3. A persistent cough or hoarseness. Most coughs disappear within a couple of weeks after a cold or seasonal allergy. But when a cough refuses to go away, especially for more than 3 weeks, it's time to pay attention. Many people automatically assume it's allergies, pollution, smoking, acid reflux, or another harmless cause. Sometimes they're absolutely right. However, a persistent cough can occasionally be one of the earliest warning signs of lung cancer or cancers affecting the throat, voice box, or thyroid. Pay attention to changes rather than just the cough itself. Has your voice become unusually hoarse? Are you coughing up blood, even tiny streaks? Does the cough seem to be getting progressively worse instead of improving? Do you experience chest pain or shortness of breath that wasn't there before? These changes deserve prompt medical attention. One reason lung cancer can be especially dangerous is that its earliest symptoms are often subtle. A person may continue working, exercising, and living normally while assuming the cough is simply lingering after a respiratory infection. Months later, after finally deciding to seek medical advice, they discover the disease has advanced significantly. This doesn't mean every lingering cough is cancer. Far from it. Infections, asthma, allergies, acid reflux, certain medications, and chronic lung diseases are much more common causes. But if your cough persists beyond several weeks, particularly if you're over 40, have a history of smoking, or have other concerning symptoms, don't keep guessing. Let a healthcare professional determine the cause. By now, you've probably noticed a common pattern. None of these symptoms automatically point to cancer. That's precisely why they're so easy to ignore. They seem ordinary. They fit perfectly into the stress and busyness of everyday life. Yet sometimes, behind these seemingly harmless changes, something much more serious may be developing quietly. Symptom number 4. Changes in your bathroom habits. Let's talk about something that most people feel uncomfortable discussing, even with their doctor. Changes in bowel or bladder habits may seem embarrassing, but they can provide some of the earliest clues that something inside the body isn't functioning normally. Think about your normal routine. Most people know what is normal for them. Maybe you have one bowel movement every morning, or perhaps every other day. Maybe you wake up once during the night to urinate. These patterns usually stay fairly consistent for years. So when those habits suddenly change and stay changed for several weeks, it's worth paying attention. For example, persistent constipation that doesn't improve with diet or medication, frequent diarrhea without an obvious infection, stools that become unusually narrow like a pencil, blood in the stool, or the constant feeling that you still need to use the bathroom even after you've finished. These can sometimes be early signs of colorectal cancer. Blood may not always appear bright red. Sometimes it mixes with the stool, making it appear very dark or almost black, which can indicate bleeding higher up in the digestive tract. Similarly, changes in urination deserve attention as well. Blood in the urine, needing to urinate much more often than usual, difficulty emptying the bladder, or pain during urination can have many possible causes, including urinary tract infections or an enlarged prostate. However, they can also occasionally be linked to bladder, kidney, or prostate cancer. The biggest mistake people make is assuming these symptoms will eventually disappear on their own. They try home remedies, ignore the problem, or simply adapt to their new normal. But your body should not have to adapt to unexplained changes that continue week after week. Early evaluation often means simpler treatment if a serious condition is found. Symptom number 5. a lump or swelling that doesn't go away. This is one of the warning signs most people associate with cancer, yet many still delay getting it checked because they hope it will disappear. Not every lump is cancer. In fact, the majority are not. They may be harmless cysts, swollen lymph nodes from an infection, fatty growths called lipomas, or many other benign conditions. But the only way to know for sure is through proper medical evaluation. A lump becomes more concerning when it continues growing, feels hard, has irregular edges, doesn't move easily under the skin, or remains present for several weeks without improvement. These characteristics don't confirm cancer, but they do increase the importance of getting it examined promptly. Women are encouraged to become familiar with the normal look and feel of their breasts so they can recognize changes such as a new lump, thickened tissue, skin dimpling, nipple discharge, or changes in breast shape. Men should also pay attention because although breast cancer is much less common in men, it can still occur. Lumps can appear in many other areas as well. A swollen lymph node in the neck, under the jaw, above the collarbone, or under the arm that remains enlarged long after a cold or infection has resolved deserves medical attention. The same is true for persistent swelling in the groin or elsewhere in the body. Many cancer survivors later say something remarkable. They noticed the lump months earlier but convinced themselves it wasn't important because it didn't hurt. Pain is not always the body's first warning sign. Some of the earliest cancers are completely painless. Waiting for pain before seeking help can delay diagnosis significantly. Symptom number 6. Unusual bleeding or bleeding that doesn't have a clear cause. Bleeding is something most people notice immediately, but many still underestimate its importance depending on where it occurs. Let's start with coughing up blood. Even a small amount should never be ignored. While infections or other lung conditions may sometimes be responsible, coughing up blood can also be associated with lung cancer and requires prompt medical evaluation. Blood in the stool may appear bright red or make the stool black and tarry. Both situations deserve attention because they can indicate bleeding somewhere in the digestive tract. Although hemorrhoids are a common cause of rectal bleeding, assuming that's always the reason without being examined can be risky, especially if bleeding continues or is accompanied by weight loss, fatigue, or changes in bowel habits. Blood in the urine may indicate a urinary tract infection, kidney stones, or other conditions, but it can also be an early sign of cancers involving the bladder or kidneys. For women, abnormal vaginal bleeding is another important warning sign. Bleeding after menopause should never be considered a normal part of aging. Bleeding between menstrual periods, unusually heavy periods, or bleeding after sexual intercourse may have many explanations, but persistent abnormalities should always be evaluated by a healthcare professional. One of the biggest problems with unusual bleeding is that people often wait for it to happen repeatedly before making an appointment. They think, it only happened once, so it's probably nothing. While a single episode doesn't necessarily indicate cancer, unexplained bleeding is never something your body should simply ignore. It deserves an answer. At this point, we've covered 6 warning signs that can easily blend into everyday life. Notice how none of them are dramatic movie-style symptoms. They're subtle changes: weight loss, fatigue, coughing, bathroom habits, lumps, and unusual bleeding. Individually, they may have completely harmless explanations, but together they remind us of an important principle in medicine. Persistent, unexplained changes deserve attention. See over every cut or scrape. The message is to notice wounds that break the normal pattern of healing. Your body is incredibly good at repairing itself. When it suddenly can't, it's asking for attention. Symptom number 8. Difficulty: swallowing or persistent indigestion. Almost everyone experiences heartburn from time to time, maybe after a large meal, spicy food, or eating late at night. Usually, it goes away with lifestyle changes or over-the-counter medication. But persistent difficulty swallowing is a very different story. Imagine taking a bite of food and feeling like it's getting stuck halfway down your chest. At first, it only happens with steak or bread. A few weeks later, even softer foods become difficult to swallow. Eventually, even drinking liquids feels uncomfortable. This symptom, called dysphagia, can sometimes be associated with cancers of the esophagus, throat, or stomach. It may also occur because of acid reflux, inflammation, nerve disorders, or other non-cancerous conditions. The point is not to assume the worst, but also not to ignore a symptom that continues getting worse. Remember, none of these symptoms automatically mean you have cancer. In fact, most people experiencing one of these signs will have a completely different, and often treatable, condition. However, the common thread running through all of them is persistence. When your body changes in a way that's unusual for you, and that change doesn't go away after several weeks, don't ignore it. Don't rely solely on internet searches. Don't wait until the symptoms become unbearable. Give your healthcare provider the opportunity to investigate while problems are still easier to diagnose and, if necessary, easier to treat. One of the greatest advantages of modern medicine is that many cancers, when detected early, are highly treatable and can often be cured. Early detection saves lives, not because cancer becomes less serious, but because treatment can begin before it has a chance to spread. So today, I want to leave you with a simple challenge. Pay attention to your body. You don't need to live in fear, but you do need to stay aware. Your body often whispers before it screams. Learning to listen to those whispers may someday protect your health, or even save your life. If you found this video informative, share it with someone you care about. A family member, a friend, a parent, or a colleague may recognize a symptom they've been ignoring. Sometimes, a single conversation can encourage someone to seek medical advice at exactly the right time. Thank you so much for watching.